I have time.
Hey
Every
Denise,
time I have time.
welcome.
Good morning. Good morning.
Good
How you all
morning.
doing?
Great, good to see you.
Same here. I think we got those other meetings together.
Yes, I did. I was gonna send you an email today to thank you for that. I appreciate that. Sorry for all the back and forth there.
Oh, that's okay. We were just going on and there's nothing there, so we was kind of confused.
Okay, yeah, I think we got it situated, so thank you.
Okay. I was wondering why I couldn't see my face.
Good morning, Cynthia. Welcome.
Good morning.
Excuse me. The weather is warm today and the sun is out and shining beautifully, so I do hope everyone gets an opportunity to step outside and enjoy some fresh air today.
Yeah, after work.
Right. After work.
After work is gone.
Duh, yeah, right.
After 5 o'clock is gone.
I'm sorry, Denise. Yeah. Maybe a lunchtime, lap or something. You can knock that out today, but
Girl.
well,
Oh
all right.
boy.
Well, it's 11:05, so why don't we go ahead and get started? As always, thank you all for being here and joining us today. I'm actually going to turn it over to our lovely co-chair, Ms. Tornisha Stokes, for our official welcome and agenda review. Tornisha?
Yes, good morning, everyone. Thanks so much for joining the Healthy Connections work group for our March meeting. So we have a full agenda. So again, I just wanted to just to go back and say thank you so much. We're glad that we really appreciate your participation in the work group, your feedback, and making this MAP 2.0 framework, taking it to the next level. So again, thank you. And so today on the meeting agenda, what we'll be discussing is the problem statement, which we discussed before when the steering committee actually did a root cause analysis and came up with different problem statements for the various work groups. And so we'll be just do that regrounding, discussing the problem statement, evidence, and strategic focus. And then we'll move into reviewing and prioritizing the draft goals and objective statements. And then, we always have our community announcements before we adjourn the meeting, and then we'll adjourn the meeting afterwards. So, Shanae and AJ will take it from here, and I'm looking for all you guys' participation like you always do. So, really excited about our March meeting and the next step. So, I'll turn it over to Shanae.
Thank you so much. AJ, if you haven't already, go ahead and restart that recording for us. Oh, I see you did, so I apologize. Thank you for that. All right. Thank you again, Tarnisha, for that warm welcome and agenda review. So today we're going to keep moving along in this CHIP process, and we're actually going to dive just a little bit deeper into our own goals and objectives. As you all know, as a work group, we have done a lot of collaborative brainstorming. We've made some decisions so far. And if you remember from last month, we actually started thinking about what success could look like over the next 3 years with our community health improvement plan. And so from these conversations, we started to draft and started to shape some initial goal ideas. And so today we'll be sharing those refined draft goals and objectives with you all today. And we'll be soliciting your feedback, gathering your feedback, and then we'll do an activity to prioritize which goals and corresponding objective statements we want to focus on for this next phase of our CHIP, which will be the actual strategy development. So before we jump into that, as you all know, I like to just do a quick regrounding moment. Sometimes we have new faces. Sometimes, we don't all make the same meeting. So it just helps us kind of start from the same place. So this information should be familiar, so I won't harp on it too long, but just a quick review. that our problem statement that was selected by our CHIP steering committee highlights that health literacy challenges make it difficult for residents to navigate available services and resources. And with the community health assessment, that data revealed that, that limited health literacy was making it exceptionally difficult for our Prince George's County residents to access and navigate county services and resources, especially when we consider factors like insurance gaps and other barriers to care, social determinants of health. All of those things combined can really make it exceptionally challenging for our residents. But Tornisha alluded to our root cause analysis discussions that we had last fall. And with those, with the feedback from those discussions, we were able to identify several possible starting points to address the problem statement. But instead of trying to address everything at once, we all decided, like, let's focus on identifying one strong starting point, something that was meaningful, something that was feasible, and that we felt could align with some of the existing efforts and resources that already existed in our county. So if you remember, we polled the group and the majority of you all selected clear centralized health information as our starting point. Specifically, how do we ensure that residents can better find and understand information about resources, services, and benefits? So from there, we discussed what success could look like over the next 3 years. We identified common themes, such as the centralization of resources, navigation support. We talked a little bit about accessibility issues, plain language, clear and consistent messaging, and how important that was, that we had that messaging across all organizations, as well as how to increase community involvement. So these were some of the themes that helped guide the development of those drafted goals that you all came up with. And so we'll be using that as a guide moving forward. But that brings us to where we are today. Your work group discussions last month generated what I thought was a pretty wide range of thoughtful and really valuable ideas. And so to move those ideas into our CHIP planning framework, we worked closely with our work group co-chairs, and we tried to, organize your ideas and your thoughts into those SMART goals and measurable objectives while trying to stay true to the original input that you all shared with us. So just a few things to kind of highlight about how that was done. Essentially, the intent of your ideas remains the same. Nothing was removed from the process. Instead, what we tried to do was group some of those similar themes or similar ideas into common categories. And that's kind of where we pulled our goals from, right? And with those common categories, like I said, it helped us clarify potential goals, and then those ideas were then structured and operationalized into some more actionable and measurable objectives. Ultimately, the goal here was simply to just try to translate you all's brainstorming into a format that we thought would help us prioritize, help us measure progress, and really help us move closer towards implementation. And so with that, I'm going to actually ask AJ to walk us through how your brainstormed ideas were organized into each goal and objective, and we'll review them together. We'll open the floor for feedback. So this is your opportunity to, write your thoughts in the chat. We always encourage you all to come off of mute to just have that engaging conversation. But yeah, so we'll share those goals and objectives, get your feedback. And then after the review, we'll move into just a quick activity or like a voting activity to help us prioritize which 1 or 2 goals we want to utilize for this CHIP cycle. All right. So with that, I'm going to go ahead and turn it over to AJ.
Thank you, Shanae. So starting with goal 1, this goal focuses on increasing access to clear, centralized, and culturally responsive health information. So this directly reflects what we heard from the group around making sure residents know where to go for information, and that there is more streamlined, no wrong door approach, right? So the idea here is to support a centralized, user-friendly, and multilingual resource hub, such as like findhelp.org, so residents can more easily find and understand available services near them. And you'll see that reflected as well in the objectives, which focuses on both increasing resident awareness and also increasing partner use of the platform as a referral tool as well. So I want to stop, pause, and give a second to digest and also to provide some feedback.
So if you all remember from last month, one of the resources that came out of the conversation was Find Help. Someone also mentioned 211, and we had a little bit of conversation about, did we prefer one over the other? Were our partners using one over the other? Some people hadn't heard of Find Help and were interested in learning more. So that's why we included that in this objective. But we're open to that feedback. So if that's not what we want to utilize, if there's something else that exists, this is the opportunity to share your thoughts. But do these goals resonate with, does this goal resonate with you, these objectives? Should we tweak the language a little bit? Open to ideas. Denise?
Yes, good morning, everybody. My main concern being in a nonprofit over 20, 25 years is that um, the resources is out there, but how can we reach out to let the residents, the community, and our clients know? Well, the clients know through us, but there are so much information out there. It's hard to reach out to them. How can we, besides 211? I have called 211 in the past, and a lot of things they did not have information on, which I felt that they should, which the resource was telling me. But how can we reach out to the community? Because it's a lot of individuals and families that do not know that this certain or these resources are out there to help them whatever they need in each county.
That's a great question. So my initial thought that came to mind was, I think that's why, as a group, we talked about having that centralized hub, right? There's so many resources out there. It's almost like saying too much of something can be a bad thing because you don't know where to start, or the pathway to take, or what is the entry point I should be using. Is this the best resource out of all the ones that are listed for me? And so I think that's why, as a group, we wanted to highlight just one centralized platform. But I can open the floor for anyone else who wants to offer any feedback or response.
And just to add what Shanae was saying, and the reason we was thinking Find Help, I know before in the past we had different um, community resource vendors to come and present at this work group. I think we also had Chris 211, Find Help. And so a lot of us vote on Find Help. And so one of the things with Find Help, though, that's important is also trying to get the community organizations to claim their information on Find Help and to really engage them in using the system so that it's updated. And once we do let the community members know that this is a centralized resource hub where you can go and get the information, that the information is updated. So we just wanted to put this out here and get feedback from, the work group and get how should that be, do you think that's the best option? And then how would that also be monitored?
I love that, Tonisha. Thank you. And that's something that, as we get into the actual strategy development next month, that's something we can really start to pinpoint. So say, for instance, we do want to move forward with Find Help. This again is a 3-year process. So maybe that first year is really focusing on partner education. Maybe year 2 is community promotion, community education. How can community members actually utilize this source? And then year 3 is, collecting the data. I mean, there's a lot of different ways that we can go about this. We don't have to do everything at one time. So I do want to just
Yeah,
make sure that's clear and that we know that this is a process. So thank you for that feedback, Tonisha. I
great
appreciate
point. Yes, thank you for clarification. Yes, to make sure. So no pressure.
it. Yeah. Any initial feedback on the goals and objectives that are listed on the slide for goal 1?
Yeah, if I may. I do remember last month we did talk about integrating findhelp.org kind of potentially like on the government website directly, if that was possible. But I also am thinking about how, just piggybacking off of what Miss Denise said, um, essentially how can you get that information directly to clients? And I know that a lot of clients do have phones and whatnot. So I wonder if there is already an app for the Maryland government or specifically PG. And if that was the case, integrating Find Help through there, it's a lot of ease of access at that point. I know it's a big ask, but it doesn't necessarily have to be an app. It could also just be available through the website and it has an integration where it's available mobily. And also just to kind of answer Denise, also just kind of getting that information into third spaces or things like that. That's probably the best way that we can get that information to people. So yeah, thank you. I do really like the proposed goal. It does reflect what we were talking about.
Awesome. Thank you for that feedback, Adam. And yes, you literally said what was on my mind. So I do know that Find Help there isn't an app related to that. So if that again is something that we want to move forward with, we can use that. As far as integrating it into government websites, I'm not sure about how that works, but we can definitely explore that and see what else exists. And then yes, to third spaces. This isn't the end all be all. This isn't we do this and nothing else. I think it's going to be a combination of things. So getting into those third spaces, the libraries, the schools, the community events that you all are hosting, making sure we have tables set up for our vendors and our organizations to attend and share. Maybe it's hosting a health fair, like a community resource fair. I mean, it could be any of these things, but just remembering that we have to think creatively and innovatively here because there isn't just one way people access information anymore. So so I love that. Thank you for that feedback, Adam.
And also if organizations has community health workers where they can leverage their community health workers to spread the word. And when they're at these outreach events or other events, with the community, just educating the residents on this resource and helping them navigate through the platform.
Love that. Thank you. All right. Hearing no other feedback, I guess we can move to the second goal. AJ?
Yeah, I was having some issues there. So moving into goal 2, this goal focuses on improving health literacy and navigation efficiency. So this builds on access, but takes it a step further, right, by focusing on how well residents can understand information and successfully navigate services, right? So it also incorporates the system side, including culturally responsive care and language access supports among providers. And the objectives reflect both sides of that, right? Improving how information is communicated and understood, as well as reducing the confusion and barriers residents experience when trying to access those services. So again, I want to pause and give an opportunity for reflection and feedback.
Marlene, I think I remember seeing you on the call, so I'm gonna actually kind of put you on the spot here a little bit. But when it comes to plain language and language access, I guess where do you see the biggest gaps in language access and cultural competency today?
Yes, it's because it's we never see the plant language in every information that we receive and to provide to the community. So my question could is how we can increase the percentage of Prince George County resident demonstrating reporting improving through promotion of plant language communication. How we can promote this plant language communication, how we can do that. And I know that Prince George is very diverse, and then we need to incorporate language access, and I think that health department is doing that. But how we can do the plant language, because the problem is the plant language in the community.
So
Do we spread the word through the community-based organization to promote plant language?
yeah,
Or okay.
I think there's a variety of ways that we can go about that. And whether that's, you know, promoting those plain language tools and resources that the Horowitz Center offers, whether it's, you know, the trainings that you all offer. We talked about having like community health champions in the community. So with community health workers, you know, maybe it's a train the trainer type of situation, you know. So I think there could be a lot of ways to go about this. But again, that would be up, you know, that would be up for the work group to kind of navigate what's available, what's not, where are the gaps, and how what makes the most sense as far as resources, feasibility, time, staffing, that kind of thing, to figure out how to do that. And then I think even begin to like I think the starting point is, you know, defining what health literacy is and making sure everyone has that understanding of what it is
Over
as a
this.
to ground it, you know, before moving on into action steps. But
Yeah,
yeah,
because the community need to know in very um, simple way what they need, especially for um, social resources or social work. Um, Many information, for example, to the food distribution, they need to know how they can get that in a plain language, or some recipes that they may provide at the same time that they provide the food distribution
yeah,
with that ingredients, because some in different areas, because I see and I vividly see many people that get so many food. This is an example, food distribution, and get the food, and then they don't know how to do with that ingredients, and then they discharge and putting in the trash the ingredients, and because they don't know how to use those ingredients, so it's waste money, it's waste time for the people that are putting all effort together to the distribution food. This is an example, and
sure.
I see that many times. So in a very simple way, um, to help the people, especially the community. But the first is to promote, the plant language through the Horowitz Center. Um, and then I think that, especially with the community based organization that you manage as a health department, I think that, yeah,
Great.
and
Thank
the
you.
objective two, one and two for me, that's perfect. Mm-hmm.
Okay. Thank you for that feedback. I thought I saw a virtual hand go up. Maybe it was Sharon, but I could
Sure.
be think
Yes,
that's
it's me.
okay. Hey, Sharon.
Hi. Um, Actually, I wanted to sort of piggyback a little bit on what Marlene said about engagement of providers and trusted community partners to to do education with clients. And I would even go so far as to say, including that in contracts with contracted providers that the county funds to, request that they have a plan for educating their clients or patients or whatever, that building the health literacy education and improving the health literacy of people who are being served through those trusted providers. And I think that trust is a really important factor. Trust and reliability of information is really important in this environment.
I think that's great.
Especially for the provider when it's federal qualified healthcare. The Horowitz Center is trying to promote that with the provider, but we understand that the providers, especially primary care providers, are so busy and they don't have any time. But at least we have training online that maybe they can access to that. And if not, we need to, and we are educating our communities in different language to promote that, asking the doctor to express or provide them information that they need in very everyday work, or using plant language, because they are using many medical terms, and then the patient didn't understand really. And certainly we have a community health worker, but we are training them also to provide this gap that the primary care providers doesn't have any time to continue to explain. They have just 15 minutes just for an appointment. So if not that way, we will be with the, we are in the community to helping the consumer, the participant, the members of community, to helping them how to ask their providers to use plant language.
Thank you for the feedback, ladies. No other comments? Then we can move on to goal 3.
So goal 3 focuses on expanding physical and community-based access points. This reflects a strong theme we heard around meeting residents where they are, not relying only on digital solutions. So this goal is centered on increasing the availability of health information in trusted community spaces like schools, libraries, community centers, and faith-based organizations. And the objective focuses on increasing the number of these locations that consistently offer updated multilingual health resources. I want to pause again for another opportunity for feedback.
So I think this definitely alludes to what Adam was sharing with us earlier about those trusted third spaces. So if it, this maybe not, if there's feedback could be, let's combine goal 1 and 3 and use the object, like we can move things around. Nothing is set in stone just yet. But if this is something that we feel is important to do concurrently with another goal or objective, like we have that flexibility at this time. But yeah, when you mentioned that earlier, Adam, I was like, oh, we have something for that. But any other feedback or thoughts on this goal or objective? Anything we should reword, change around? Anything we're missing here? Hearing that, we can move forward. I think this is our last goal.
And then goal 4 focuses on implementing a community-led health navigator model. This reflects the emphasis on navigation support and community involvement that came up throughout our discussions. The idea here is to build a model where trained community members can support residents in navigating services, accessing care, and applying for benefits. So the objective focuses on both implementing that model and building the workforce of community-based health navigators to support it. I'm going to pause again for feedback.
I think that those objective 4.1 and 4.2 are so perfect. I agree with that because in this case, I think that community health worker can work like navigators too, and training them is is so perfect. And then the community health worker is is the bridge between the social services from different agencies, local agency or local government and federal government through the community, especially um, in different language and um, also with cultural sensitive. Is so important, especially Prince George, that is very diverse. Mhm. And can be in different areas about social services or information about social service.
Thank you for that feedback. Any others?
And I agree with Marlene, like the community-led navigator models that include community health workers, social workers to make sure that the residents know about the different services. Like for instance, the health department has the MGIP program that help patients get enrolled into Medicaid. DSS has a program that helps people apply for health insurance. So like Marlene mentioned, like community health workers can be that bridge. So I agree.
Mhm.
Awesome feedback.
Yeah, that part that is in digitally underserved population is so important, especially for the senior um, community, because technology is no their strength, right? For the seniors, and is the senior are like on the server population sometimes.
Yeah, that's good. My brain is already starting to like connect all these dots. So, and thinking about even like the conversation about the third spaces, right? So you could have those CHWs or those health navigators, whatever they are called, serving as that bridge. And maybe they're not just in the doctor's offices, but they set up tables at the library and they have set dates and times where you can come and get assistance completing a Medicaid application, or, maybe they're in the lobby of the health department, or maybe they're somewhere else, just trying to kind of work all of these things together, so that way we can find creative ways to address the problem statement. But I do see value in having those community health champions, those CHWs, the social work case managers, um, assisting people with connecting to care and helping them navigate that and understand the information they receive from their doctor's offices, or maybe it's interpretation support when they go to the office. I mean, it could look a lot of different ways. So that's something that we can consider when we get into the actual strategy development next month. But Yeah, this is great. Thank you for the feedback, everyone. Any other comments, thoughts? Anything we need to tweak? Anything, any other models or programs we should consider outside of that CHW model?
And this is just a comment. I think it was Marlene and also Margaret Tilsey under the Chestnut program. They'd had CHWs at these different locations, but it was more education around COVID. But that was something like these third party, these community centers or others. Organizations in the community where we know people, where patients go, like even the churches where we can have CHWs there to help patients navigate through the resources such as healthcare insurance benefits, whether it's need for utilities, housing, or so forth. So I think it's a great idea. I like this goal.
Any other comments? All right, hearing none, let's move on. Thanks, AJ, for sharing those with us. I really appreciate you doing that. Okay, so yeah, so we just walked through those goals and objectives. We got some feedback, which I took notes on, so we'll make sure to incorporate, it's almost lunchtime, some of those notes and feedback with you all. But I did want to move us into the next step for today, which is prioritization. So to help us prioritize these goals and objectives, we're going to use a method called dot voting. Some of you may be familiar with this, some of you may not be, that's okay. But it's essentially just our simple, quick, and inclusive way to try to identify where this group has the strongest alignment and collective support. So how this works, essentially, we're going to transition to a whiteboard again in a minute or two, but you all will get 2 votes. You're going to see a bunch of little dots on one side of the screen, and you all get two dots or 2 votes. You can place your votes next to the goals you think we should prioritize. And there's 2 ways you can do this. You can have 2 separate votes. So place 1 dot on 2 separate goals. Or if you feel very strongly about one specific goal, you can place both of your dots on that goal. But this is just a way to make sure everyone, has a voice. It allows us to quickly and clearly see where there's that shared priority across the group. And then once everyone has voted, we'll tally those results and see which 1 or 2 goals we will prioritize for this CHIP cycle. All right, so with that, I'm going to ask AJ to go ahead and share the whiteboard with us, and then we can start voting. I don't think this is the right one, AJ. There we go. Awesome. So you should be able to zoom in. I know the font is a little small. If anybody has any trouble navigating that, there should be a zoom option for you all. Oh, there we go. And there are light blue dots to the right of your screen. So you can go ahead and grab 2 of those, and you'll place the dots in the white space next to the goals. So not on the Post-it itself, because we want to make sure everybody can still see the goals and objectives.
I don't see it. Anybody else see it? But I
I
don't see
I
it.
don't see it.
Oh, no. Okay, let's see.
I see it, but I don't see how to put a dot.
Okay, give me 1 second.
Yeah, there's an arrow down at the bottom of the screen that says select where the hand raised the pencil at the very bottom in the middle. If you click on that arrow and then drag it over to the blue circles to the right, and then drag it over to what you're voting for.
1 second. I put the link to the whiteboard in the chat just in case for those who aren't able to see it at the moment.
We joined from an online browser. Could that be an issue? instead of accessing it, this meeting from the app.
Let's see. Sorry, I'm not the most tech savvy person, so you'll have to bear with me, Adam. You're unable to open the link that I shared in the chat in your web browser?
Actually, yeah, I got the link.
Okay.
But it says to open this link, we'll need you to enter the email that this item was shared to.
Right, and it's not doing it. Mhm.
Okay, Plan B, I will put the goals and objectives in the chat. And if you want to just indicate in the chat what you're voting for, or you can send me a private message if you want that to be anonymous. I'm so sorry, Mom.
That's okay. And I want to recap what.
Can I, for me, they don't
Denise,
allow
I
me
think
to
you're
enter.
muted. I heard you and then I didn't.
I'm sorry. I said I want to recap what I said earlier once we get this done, if I may.
Sure. Give me 1 second, everyone.
I'm just making a poll.
Oh, okay. Sorry for the technical difficulties, everyone. And AJ, maybe with the other work groups, we'll just go ahead and do that too.
So I can go ahead and leave my my vote in the chat.
Okay, thank
My
you.
votes.
Received. Thank you, Adam. Thank you, Cynthia. We'll leave another minute or two. Thank you, Denise. And again, if you all feel strongly about one goal, you can place both your votes on that one as well. It's totally fine. Oh, thank you for the poll. Thanks, AJ.
So it allows you to vote for more than one, but if you could just only use 2 votes and then submit, we can tally those up. We really appreciate y'all working with us. Thank you.
Okay. With another minute. Anyone else having any issues navigating?
I think we got 5 responses so far. We need about 5 more.
All right, let's give it another 30 seconds.
You typed it in there.
Yeah,
Did he
so sorry.
go?
I did write in the chat my votes, but I was unable to submit it using the poll.
Oh
Um,
gosh.
so is that okay? Can we just include my vote? Okay, all right. Thank you.
Yes, I noted it. Thank you.
I was doing the same thing, Chennai, because
I
they
got you.
don't allow me to enter.
Okay, it could be the external organizations that are having some issues. So no problem. If you put your vote in the chat, I can see it there. So thank you so much. All right. My apologies for the tech. Gotta love it, right? It's funny, it worked in our last work group. It's not working in this one, so we'll just find a plan B for the next group. Totally fine. Thank you all for being patient and flexible with us. Really appreciate that. All right. Well, if nothing else, I don't see anything else coming in, so we can go ahead and close that. And we'll tally those votes and make sure I'll share that those end results with you all in the follow-up email that I send probably tomorrow. All right. All right, well, moving on, then we'll go ahead and start closing out this meeting with our community announcements. But as always, thank you all for leaning into this process with us, and again for your patience with our tech. So next month, like I said, we're winding down now. We're getting to the end of this chip process, right? So we're gonna use that goal that you all selected, and we're gonna start digging deep into those strategies. So looking at how we want to address this, who takes the lead on what, who helps with what actions we're going to take, how we're going to measure success, and what our plan is over the next 3 years. So excited about that. I know we kind of started way out here, but it all comes together, as you can all see. It's like a puzzle, and I love puzzles. But so your continued engagement, as always, is going to be super important and super necessary, because we don't want to come up with all the ideas we can, but this is the community's, document. This is the community's plan. So we need your voice. We need your feedback. So that way we can all work together towards this common goal. So thank you all so much. And with that, I'm going to turn it over to AJ again for our community announcements.
There we go. I couldn't unmute. Thank you so much. So first off, we have the Bridge Center Open House. This is actually taking place tomorrow, March 27th from 10 a.m. to 3 p.m. This event is really focused on supporting returning citizens, their families, and service providers. It's a great opportunity to learn more about available resources and make connections in that space. There will be refreshments, lunch, and giveaways provided. And if you're working with or connected to returning citizen populations, this is definitely a great event to share or attend. Next, we have the 12th Annual Swell Conference and Retreat. This will be held April 16th to the 18th in Ocean City. This is a multi-day professional learning and wellness experience for folks across behavioral health, healthcare, and community-based services. It's a really good opportunity for both professional development and just intentional time around wellness and learning in a supportive environment. Registration will be online, and more information is available through the conference website. Next up is a more community-centered event, Come Out and Play. It's offering free ice skating for all ages at Bowie Ice Skating Rink on May 1st from 6 to 8 p.m. This is a great opportunity for families and community members to get out, be active, and connect in this fun setting. Next up, we have the GOAT, G-O-A-T, Youth Mental Health Expo coming up. This will take place at Bowie State University and is focused on youth ages 16 to 25 and their families. It's a full-day event with workshops, resources, live performances, and support focused on youth mental health. It's free to attend, so definitely something to share with youth serving partners and families in your networks. Next, we have the Spring Into Wellness Behavioral Health Expo. This will be held on May 16th from 10 a.m. to 2 p.m. at the Southern Regional Technology and Recreational Complex. This is a really comprehensive community event with health screenings, fitness demos, food demonstrations, and a range of behavioral health resources. It's designed for all ages, so it's a great opportunity for families to come out, engage, and access resources in one place. We also wanted to shout out the Brain Health for Every Generation event coming up on May 23rd. This will be held at Harmony Hall and also has a virtual option. This event will focus on practical ways to reduce risk and build resilience across the lifespan, and it brings together both experts and community members. So it's a nice mix of education and community conversation around brain health. And I think this is the last one. This is Camp Nabi, a youth grief camp taking place August 7th through the 9th. This is for youth ages 6 to 18 who've experienced the loss of a loved one. It's a full weekend overnight camp, and they are currently looking for both campers and volunteers. So if you're connected to families or organizations supporting youth experiencing grief, this is definitely something to share.
Awesome.
And okay.
No, you're good. That's the last one. Any announcements from our community partners?
Yes, I'd like to share the CC&G is having a potato drive on this coming Saturday. Can y'all see that?
Yes. Can you
Okay.
share the link in the chat or email it to me and I can include it in the announcements?
Yes, it's going to be Saturday, March the 28th, 10 a.m. to 2 p.m. At 12301 Old Columbia Park Road in Silver Spring in their parking lot. Free potatoes. So we need people to scan this code to register and bring your own bag and come and get some potatoes. All is welcome.
Love it. I love it. That's funny.
Come and get some of these potatoes, guys.
That's
You can,
cute.
then please pass it along, okay? But please have them to register as well.
Yes, ma'am. Thank you. Yes, please send that to me in the email and I'll make sure to include it tomorrow in the follow-up email.
Right.
That's so cute. Any others? Right. Well, hearing none, as always, if something comes up between today and noon tomorrow, feel free and forward it my way. I think I see something in the chat. Oh, that's for the survey. Yes, if you haven't already, please go ahead and scan the QR code. Denise, if you can unshare your screen, that would be great, or I can go back and share mine, but go ahead and click the link, scan your QR code, so that way you can complete the survey so we know who's with us, we know information has changed, we have new people with us, so we want to make sure we have an accurate count of who is with the coalition, as well as give credit to those who have been contributing to this community health improvement plan process. So, and then I don't think anybody's seeing my screen, but that's strange. Gotta love tech. Gotta love tech. Here we go. Let's see. I apologize for that. Yep. Okay. And yeah, so again, just a quick snapshot of our upcoming work group meetings. We're listing them all, as we know we have some partners who like to be a part of other work group meetings, but highlighting next month's meeting for Healthy Connections, Thursday, April 23rd, same time, same place. So we're looking forward to having you there, connecting with us and working in the next phase of our chip development process. Again, we are winding down, so I think we will be done end of May, June, we should have this finished. So as always, just thank you all for your participation. We cannot do it without you. And with that, we will close. Thank you, thank you, thank you. Your insight and your partnership is always valuable. We appreciate y'all being here today, for your patience, for your insight, your contributions, and feedback. And we look forward to continuing this work with you all next month. Have a great day, everyone. Thank you so much. Enjoy the sunshine.
Okay,
Thank
do
you.
the
Thanks,
same.
everyone.
Bye-bye,
Have a good
everybody.
day. Bye-bye.
Bye-bye.
Thank you so much.
Thank you.
Say.